Okay. So, good afternoon, everyone. Thank you so much for coming to this session and really appreciate it. Today, we are celebrating World Heart Day, and I think we thought that it would be very important for us to just be part of this session to celebrate the day and also understand the importance of how the heart affects us, right, as individuals, and obviously a very important part in our body. So we thought that we could have this session and talk about the health effects that it has on us and have an expert with us today to talk to us about the early signs that we should watch out for in terms of our heart health, the foods that we should include in our diet to stay healthy. Also, obviously, I think doctor is just going to also highlight the importance of how we should have a less stressful life, right? So the way we live, these are the key aspects that doctor would focus on. And so today, it is our privilege to welcome Dr. Ashutosh Kumar. He is the senior interventional cardiologist and an electrophysicist and has an experience of more than 15 years in cardiology. He did his MBBS and MD from the Banaras Hindu University. He obtained his DM cardiology from the Institute of Postgraduate of Medical Education and Research, Kolkata. And currently, Doctor is part of the Care Hospitals. He's a senior director there, and he handles the same department. So I would request Doctor to please take the session forward and talk to us about the importance of how we live our life and a healthy life, right? So welcome, Doctor. Thank you so much for joining us.
Thank you, Raki, and thank you, Nandini, for the warm welcome that you have given. And I am delighted to see so many people are sitting and very much interested. So, without wasting time, anything can is possible, but without heart, nothing is possible. The first organ and the last organ, it is the heart. And if at all, if I have to summarize about the heart is something like we call as a mother. It is tirelessly working without any paid attention, and even without leave, without holiday, and something very equivalent when we are dealing with the heart, it is something like that. If you are sleeping, heart is not sleeping, it is still working. And its working level, if we going to see, is 1 billion times it will be beating throughout the life, tirelessly without being appreciated. When we are appreciating, it is the doctor. So, it's not moving. So how many people are very versed with English, Hindi, and Telugu? Can anybody raise a hand? Who are very much in all three languages? How many people are with Hindi? Only one person. Okay. Means you're able to understand or not? Okay. Because I just wanted if sometime I slip from English to Hindi and sometimes Telugu. So I'm not very good in Telugu, but wherever possible, I will try to be mostly in the English. But sometimes the punches are needed, or we can say the point has to be clarified in the Desi language. So we will come on that point also. Yeah.
We will translate.
Yeah. So I think English is a well versed for everybody, and the first thing we come across when we are choosing the doctor. So one is called cardiologist. I think everybody is doing heart specialist. And second, what Madam was using the term electrophysiologist. So it may be a new word for you or a buzzword nowadays. दिल के धड़कन के डॉक्टर मीन्स दिल जो धड़कता है उसके रेगुलरिटीज को मेंटेन करने का जो काम होता है वो इलेक्ट्रिशियन का होता है हार्ट का इलेक्ट्रिशियन अलग होता है हार्ट का प्लम्बर अलग होता है so the person who are taking care for your which one there is
they are also
yes
no
which means So intervention is basically the plumbing job. Wherever the block is, we are going to open it, putting a stent and coming out. And the electrophysiology, wherever the electrical problem is there, so when problems comes, we have to identify the doctors, which doctors we have to reach. So I will not go in detail, but at least for the time being, you should know electrophysiology is the electrical system of the heart. These are the doctors who are dealing with a sudden death. They are the doctors who are dealing with the palpitation, means giddiness, sudden loss of consciousness, fainting. This come under domain of electrophysiology, and intervention, the heart attack, blocks, all those things are dealt with the intervention cardiologist. And we are means this was our discussion, and all of a sudden a lot of sudden deaths are happening, and these are the news which you may be knowing, either the Puneet or some Ankur Bhatia and Raju Srivastava. So these persons has given a lot of ripple in the society that when you are exercising, you can die, and a lot of what you call information has been floating. Exercise kills the patient, or somebody say the post-corona you can die anytime. In the Puneet case, if you are doing a lot of exercise, putting a lot of muscles, certainly there is a high risk of developing the heart attack. So, yeah. So coming to the risk factors, so in the risk factors, what we have been taught when I have entered in the MBBS in 1995, we are having very very typical risk factor which everybody in the population who is sitting here or who is with us, the diabetes, hypertension, abnormal lipid profile, tobacco, either it is in cigar or smoking, physical inactivity and obesity. These are the conventional risk factor what we have been taught during our MBBS time, MD time. But the scenario is changing now. You can see this is the one of the case which needs what you call understanding how the things are evolving. So these are 22-year-old male, non-smoker, non-alcoholic, normal lipid profile, no family history of coronary artery disease, 22 years, and he came with and he's a daughter, he's a son of a nurse who's working in a periphery, and brought by that he's having chest pain, 2 days back he is, and when he came to our hospital, he was having, sorry, इसको run करना पड़ेगा, somebody can downside we have to run it. So the patient is it was running on that one also. So the patient is having a, where is the laser in this one? Laser, yeah. Yeah, this is the reason what white you are seeing here also here. This is the clot. So big clot was there in the main coronary artery, and later on we put the thrombosection, means we are able to take out the clot, and the patient was revived, and the artery is totally circulation was regained. But what we are facing when we are doing all the tests of from the diabetes panel, from the even the advanced risk profiling, we do the lipoprotein A level. This is the one of the advanced level, and coagulation probably maybe some clotting issues may be there. But in this patient, there was nothing abnormal. And what we are seeing nowadays, the important risk factor, that is the obesity. So this boy, he has gained around 15 kgs in the last 2 years. On top, he was engaged in the social media, chatting, gaming. He and his friends both are sitting one on the other room or other place, and from there they will be overnight they will be playing. And this is going most of the time maybe 4 or 5 days in a week. And the important thing, binge eating. Eating what? Biryanis, pastas, and those things in the night hours. So when everybody will be sleeping, they will be ordering, night time they will be playing, and they will be enjoying. And sedentary lifestyle. So this was going for almost 3 years. And if you see in and around in your own family, a lot of people will be, or your family member will be having this type of problem. Thank God that everybody is not facing this type of heart attack, but this was unfortunate. And these are the things where we are lagging behind, or we are not able to understand that it is not the story of cholesterol. There is something beyond. Cholesterol was of our generation, millennials, that we were thinking, okay, cholesterol high or diabetes, hypertension. But the important thing, what we are missing nowadays, the food, type of food, timing of food, and the quantity of food. These three things we have to work, or we have to keep in our habits, and accordingly, it is going to make the difference in our quality of life and morbidity-free diseases. So regarding the food, Indian foods are very good. There is no doubt. Either you are North Indian, South Indian, or mixed, it is good. Only thing we have to keep watch on the calories. So calorie is the important part where we. Second point regarding the sorry, I forget. The question arises which is better, non-vegetarian versus vegetarian. And in the vegetarian, we have to be very mindful that wherever possible, vegetarian always score over the non-vegetarian. And the reason behind it that when you are taking more non-vegetarian diet, your gut bacteria, which is inside, which is digesting your food, uh, it is going to convert one important molecule that is TMA. So TMA is a molecule which makes the inflammation inside the body. So TMA is the thing which trimethyl that is going to be when you are taking more L-carnitine, choline, and lecithin, which is rich in the non-vegetarian diet. It is going to convert to the TMA, and this TMA will be again coming to the liver, where it is going to TMA oxide, and this is prothrombotic and inflammatory. So all the cancers as well as the blood coagulability is going to increase if you are not taking care what you are supposed to take, because as a human we are having only four canine teeth. Four canine means we are omnivorous. We can survive on the what you call non-vegetarian, but it is not primarily a non-vegetarian by origin point of view. This is an important concept that we should know. Gut microbiota means whatever the bacteria we have inherited from our parents, particularly from the mother at the time of birth, it is your property. Like हम लोगों को अपने father mother से जो property inheritance मिलता है, the one part is this also. Second is the genetics, what gene we are taking from our parents. So that is a fixed gene, means whatever parents has given, that is fixed. This is the thing which you can moderate, you can change by your dietary and food habit and your lifestyle. And these are the areas when you are fingering, means by your diet habit or your sleeping pattern or behavioral thing, it is going to convert into the normal person to the disease. And this is very important for those people who are vegetarian by their lineage, means their parents are totally vegetarian and they slip into the non-vegetarian due to their company or their spouse or their friend. Later on, the gut bacteria started changing. The bacteria which are not supposed to be there in their gut, they started predominating. And what I was saying, TMO production increases, and the chances of developing from the heart diseases to the cancer, all these things goes up. So far we are thinking about the coronary artery disease, but this gut bacteria is not limited to that. Cancer relationship means how you behave in the environment, your psychiatric means you can say emotional level, that is also being defined by your gut bacteria. So things was not simple. Initially we thought, okay, everything is by in and around the atmosphere, but it is now we are tracing back that when the inside bacteria, what we are keeping virus, or bacteria as well as the virus and fungus, if they are changing, how the milieu inside the metabolism as well as your mindset, as the blood level metabolism, all these things changes. So this is the important from, you can see from the heart failure, kidney fibrosis, atherosclerosis, what we are saying, the heart attack type. Everything is indirectly and directly linked with the gut bacteria. So gut bacteria is the second important, after your genetic, the second important thing which predestine whether you are going to develop a disease or not, and when we are going to disease. Regarding food, so whatever, if it is not a junk food, I don't think it is need to be defined at this level. Everybody is knowing what is junk. So anything which is processed, kept in the for long time, which is full of preservatives or altered food chemicals, they are never ever healthy. So Indian food, which is recently cooked food, if you are consuming in a what you call mindful way, means the what is your activity and accordingly you are taking, it is not going to affect in the long term your health. So always you have to keep the check between what you are eating and how much you are exercising. Means in and out should be always. like a top line and bottom line, it should always match. Now regarding the timing, so timing of taking the food is very, very, very important. And it is important because now Zomato and Swiggy is available, their business is growing up. And whenever weekends are there, or you can say whenever you are getting the time and feeling bored due to any issues, maybe your boss has given something or your relationship, your girlfriend, boyfriend, you will start eating or doing nonsense things. So in that, food is one of the things, and people whatever how to come out of their depression, they start taking the food. So so there is an important study has been conducted, but when you are taking even the one of the bad food, food rich in the fat tissue, you are giving in a time restricted manner. Means you are giving from 8 o'clock till 5 o'clock. After that, it is totally off. And giving to the other population from 8 to 8 means आज से लेके कल तक पूरा खाते रहो पेट भर खाओ कोई नहीं. The difference is the person who is taking food between 8 to 5 and after that he has kept everything totally off till next morning 8 o'clock, 8 o'clock in the morning. Those people didn't develop diabetes, hypertension, block of the kidney, all those whatever the metabolic diseases has been prevented. So this has been conducted in the mice or rat, and later on it has been seen in the human population. So when you are consuming anything in the night time, you are altering the nature's rule that gut bacteria which is there, which is predestined to sleep or they should not work in the night time, you have kept on the night shift. That is the worst thing you have done. And you know that they are the worker for you. You are having only 1 or 2 trillion. You are having 3 trillion bacteria inside working for your digestion of the food by the juice what is released by you inside the gut. So when you are altering those things, the things will start working against you. Bagi ho jate means they will start revolting. And revolt kaise means what has to be thrown outside through the anus, they are putting inside the blood. And what will happen then? If it is a slow process, slow poisoning, cancer. If it is an acute process, it will be inflammation, all those blocks. So these stories start from here. So circadian code, it is one of the Indian scientists who has conducted in the South Institute of the US, and he is very well known for conducting that. When you are taking food in the night time, the chances of developing, or if you are not sleeping, doing a lot of stress, and on top you are taking the food round the clock, then the chances of developing the metabolic diseases are very, very high. Now, coming to the third part of the food, regarding the quantity. So I think quantity, I think anybody can read what is written. I don't want to read it because it doesn't look nice. So 1/4 of what you eat keep you alive, and the other 3/4 keep your doctor alive. So we are surviving by your food eating habits. The whole hospitals and whole hospital, what you call healthcare sector is surviving just you are eating for us. Okay. So quantity, if you are going to reduce, certainly it is going to make. We have talked a lot about the eating, but the most important thing we have to fast also. I think none of the religion is out of the fasting habit. So most of the religions will be having on a particular month or days in a month that you have to keep fasting. And again, I'm saying it is for the gut bacteria. You have to give rest. They should enjoy 1 day holiday or at least a 18-hour holiday. You are not giving them. Certainly you are going. And this is one more thing. What happens when you are fasting? So this is now the science is also giving the reasoning. They will use a different word. As a Hindu, I will say it is a Ekadasi or particular vrat. If you are going Muslim, they will be having Ramzan. The Christian, they will be having a holy month for that, or I think 40 days. They will be from the starting from 15 to the from yesterday to a particular day. They will be keeping for 30 or 45 days. So everybody is having, and what it has been seen that when you are fasting, what is happening? So your fat tissue will start burning. So the burner is going, means your inside burner is on for the bad tissue. It is going to burn out. So the things which is disease, like if anything flood is coming, the young people will always survive because of their what you call vigor. But the old people will totally washed out. So same thing happen when you are doing the fasting. The old tissue mutated tissue, dysplastic tissue, that will be out. They will be engulfed by our own mechanism, which we call as autophagy. So they will engulf those things, okay, out. So your chances of cancer, your chances of inflammation, everything come down. So when you are repeatedly doing on the monthly basis, daily basis, the chances of developing heart disease, cancer will reduce. So this is the means a silent bullet. If you really want to be young enough, you want to be free from the disease, you want that you should lose the weight, try to practice fasting wherever possible. So fasting, I think, is a well-known thing from our independence time. So Gandhiji has given the independence what we have been doing by doing fasting. But fact, I don't think it is the same. Everybody agree with this one? Okay, fasting has provided the what you call independence. Huh? Yes, I like this. So yes, it is a political, and it has been politically created that yes, Gandhiji has done, but a lot of people doesn't know about him. Jatinnath Das. Have you heard about him? Just we will be seeing like a stamp like this, but note of a particular person will be floating everywhere with some reasons. He is the person who has fasted for 63 days for the independence of India, but we are not knowing him. He was only 25 years when he was caught, and he was at हम अपना झंडा लहराएंगे तभी जाके हमको, and he has died for it, for the country, but we are not knowing. We are knowing only one or few person who has been what you call politically brought in the map. And if you even fast in present time also, you will get a lot of what you call opportunities. And the best opportunity you are seeing on the, so you should write with the right person. Certainly you will acquire change. So fasting is good in any way. Now coming to the second part, the exercise part. So खाना हो गया, fasting हो गया, next what we should do. So कुछ exercise तो करना पड़ेगा. So this exercise is the what you call important component. We human being is having given two legs and two hands, and we have been separated from the what you call animal kingdom, that we can stand on two legs most of the time and we can do everything. So why we should exercise? Benefit, duration, and what we should not do. So this question has been a lot of time asked, because unless you are not knowing why we are doing it, you will never do it. I think about him, everybody is knowing. Anybody? Okay, good. Anybody else? Huh? Okay, next. He's Simon Sinek. And I think whoever is working in engineering or I can say IT sector should know him, because he, no doubt he's a motivator, but he has given one book, Start with Why. Unless you are not knowing your why, you can't be able to enjoy your job. It will be a burden for you. And certainly after some time, one job, second job, third job, you can't be able to innovate in any of your field. And ultimately, you will come to the back to square one, means money has come, but you are not enjoying it. So everything should be clear. So in this book he has written, so exercise, why we are doing it. We want to become Milkha Singh? I don't think anybody is interested to become Milkha Singh. But good thing about Milkha Singh is that he was a person who was running throughout his life till his last, when he was 91-year-old. I think the last pandemic time, the last what you call wave, he was having corona, and I think 2 days he was in the hospital. He left the world. Not a single time he was admitted. Not a single time he was having any illness for need he hospitalization. And the best thing, whenever he's having any problem, his wife will say, "You are having headache, Sardar ji, thoda ye dawa le lijiye." To bolte tha, "ठीक है, dawa दे." And what he was doing, he was putting under the pillow and he was sleeping, and next day morning he will go for the running, his fever is over. So his remedy of anything was running. So running was giving his a kick, and it was solving his all the problems. But as a cardiologist, why I am banging on running or exercise? Because exercise provide the roadway for what it was circulation, which can't be made by any means else. So if you are exercising, the exercise is having an impact on your circulation. Your circulation will become more what you call wider, means the arteries will become somewhat dilated, means it will provide more nourishment to the particular area. It will start budding more small vessel, we call it the channel or collateral circulation. So even if you are developing a block over the time, they will bypass it. And how? So exercise, whatever, sorry. So in exercise, when we are exercising, these are called collateral circulation. So every person is having some collateral circulation which is ongoing. And whenever we are exercising, this will become more wider or will become more abundant. So even you are getting a block due to any reason, due to the inflammation or some clot has blocked your major artery, the circulation will start flowing through this one and it will bypass it. So it is called natural bypass. So if you are exercising more, you are challenging the cardiac existing system, you are recruiting the more budding of the coronary small vessel, we call it the collateral circulation, and that will provide the salvaging mechanism when you have developed the heart attack. And there is no other way to do it. Either by diet, you want to develop, not possible. Medicine, not possible. No way. If you are exercising, you will be having the chances that you can survive even the heart attack happens. And this is one of the reasons that a lot of patients walk in our what you call chamber and they're saying, I'm having chest pain for last 2 days. And the reason is these collateral circulations are providing the alternatives way for what you call providing the nourishment to the down the artery. So minimal pain. They will not be having much pain. Some pain was there, sweating, kept for a while, and then they walk to somewhere, feel somewhat comfortable. 2 days later, they are coming. The reason is this one. If you are not having collaterals, your story is somewhat difficult. So these are the story of what people are saying, silent heart attack. So patient, we see the ECG, we see the echo and say you are having heart attack, and patient, no, I was not having any pain. Why you are saying like this one? And the reason is this one. So he's having the block here. The collateral circulation already built up by his lifestyle, what you call the exercising and this capacity. The blood is started shunting from this part. Even though this is blocked, it has been bypassed. So this is very important for everybody who is sitting here. If you are thinking, if you want to make your second tier of protection against the heart attack, exercise the way to go. Now coming to the benefit. This is the one benefit related to the cardiac. If you are exercising if you are exercising, the person who is having active versus inactive, the cardiac risk reduces. That I think very important. The person who are walking more or who are person who are active more, the chances of heart attack or the coronary artery disease will reduce. It works on your obesity, hypertension, cardio, respiratory fitness, diabetes. All these things will fine tune towards the normal. Or if it is very abnormal, it becomes less abnormal. Like that, it will be. And this is, I think, doesn't need to impress on this point that the person who is walking more, their life will be longer. And this has been conducted in the studies also. Your, what you call, steps per day, if you are crossing 14,000, the chances of risk is reducing markedly. So number of steps, the life will be better and longer. And that's why I was saying, mind your step. So whenever you are walking, wherever you get the opportunity, you should take the opportunity. If you are going by the lift, or you are having the opportunity to take the lift, go by this one. Every step 0.5 you are going to add on. I use the word, I use the word exercise as a future investment. Everybody is very busy for the money investment. इस एक के बाद दूसरा घर, दूसरे के बाद दूसरा property. Everything means your mind game till you have not landed in the ICCU. You will be thinking next. ये गाड़ी, ये बंगला, ये family, ये boyfriend, ये girlfriend. All those things will be going in the mind. But the time you come into ICCU or any time you have, I don't think anybody has, and God should not give any opportunity to you. If you go inside, then you will feel what exactly the life is. So if you really want not to land up, the future investment is start from now. And the investment is, if you are exercising more, you are going to release one important irisin. Irisin is a one molecule. When you are exercising, it is spilled in the blood, it is coming in the blood, and it will change the fat tissue from the white to brown, because the browning of the fat tissue. It works on your memory. Memory will become better. You will be performing better. And neuroplasticity means whatever recovery happens, there is a nerve is an important part of that component. So your recovery of any illness, either it's a cough, cold, fever, pneumonia, anything will be far better than the person who is not exercising. And you go and check in your family, the person who was active, he will immediately get cold and cough, and within 3 to 4 days he will be again back to the same. The person who say, मेरे को ये हुआ, अब आगे क्या? The negative attitude, more sedentary, they will be having a more morbid period. So your bone will be stronger. So ladies, for the ladies who are 45 crossing, they can build up their bone or become stronger by exercising. Your memory will be strong. You will be young, because everything is defined by your memory and your attitude towards the life. Your beta cells will be increasing, which is required for the insulin, so that chances of diabetes will be less. Your liver will be not accumulating the fat, and fat-related issues with cirrhosis and all those things. And your immune system will be up. So all these benefits are there with a simple exercise. So regarding the income, passive income and active, what you call two words we are passive income. Everybody want a passive income. कि हम ना काम करें, somebody come and money should come to you. But in active income versus passive income, same thing comes for the health also. You have to invest time. So when you are investing time, it is a health investment. When you are investing money, it is the health insurance. So there are two different things. When we ask the person, they will say, "Sir, I am having health." That has been bought by money to enjoy the best time in your ICC in hospital, so that you should not have financial trouble. But if you don't want to land up, you have to invest the time for your health, and whatever best way you can do it. So for everybody, both are needed. So health insurance is also, you should save your money, and health investment, put your time so you can do the best. Now coming to the second part, the duration, how much we should do. So at least 1% of your day, is it possible or not? Or 2% or 4%, how much it is? It is only 15 minutes, 30 minutes, 60 minutes. But we were having a lot of reasons, sir, I am very busy. My boss say morning 9 o'clock till 12 o'clock in the night. I'm like, okay, yes, excuses you will get, the time I will say that now you are diabetic or pre-diabetic. No, sir, dawa mat dijiye humko. I will do whatever you want next 3 months. Then they will come on the track. That is the right time to, but since you are sitting here, I think it is the best thing that you should done. आग लगने से पहले सब चीज का इंतजाम करना है, उसके बाद whatever is happening, you should be prepared. So preparation is the best thing. Be proactive in your life. Wherever you are, if you are thinking your father is a diabetic, mother is a diabetic, brother is a diabetic, you are already taken some genes with them, like a property. Property मिलते तो बहुत खुश होते हैं कि मेरे को 30% मिला, 50%. When it comes to the gene, they will no, ये नहीं चाहिए था, मेरे को hypertension नहीं चाहिए था, पता नहीं क्यों मेरे को मेरे father को था, मेरे को. This is not good. We have to take everything from our parents. So let us be honest in that. Yes, we have taken the genetics, we have taken the what you call their investment we are sharing. So, and one important truth, whoever is here, exercise makes time, not take time. This concept you should just ingrain in your mind. And I think how many people agree with on this? I think most of the people, because the time you start doing the exercise, your efficiency goes up, your mindset goes up, and the reason you release endorphin, you release serotonin, you release a lot of other things which is positively helping you. You feel good, you feel loved one, you feel that you have utilized that time in the right way. The feeling of guilt goes up. The same thing you enjoy in the bed or think, आज का काम वो कल करना था, कल हम दौड़ेंगे. Suddenly you will come out with the negative. I have wasted today's 15 minutes, 20 minutes. So those things are very, very, very important. So whenever possible, so 150-minute endurance exercise training per week, if you can do it in a week, I am saying, and 75 vigorous activity. And you can just regarding the resistance versus whichever is, if you enjoy dancing, what is the need of going for running and doing any gym? You can go and have a Zumba, that is enough. 15-20 minutes Zumba is enough. It is the same effect what the person who is jogging. So if you are swimming 15 minutes or 10 minutes also, it is nearly half an hour of your jogging. So exercise, calorie burning, and feel good, you will get the same. Resistance exercises are no doubt there is a difference of opinion depending upon the disease, and I will not strongly recommend that everybody should go for it. If you are not having a healthy lifestyle, you are not doing the nature's practice, sleeping in the night and daytime working, all those things are not in order. If you are exercising all of a sudden with the resistance exercise, you are not doing the cardiac strength, that may be a problem. It's not a right way to go. First, go for the endurance, and later on, you can add on the resistance exercises. Who should not do? So exercise सबको करने के लिए बोला. There are some breed who should not be given, and who is going to tell them you should not exercise? Anybody? A lot of people are yawning. Okay, no problem.
Post lunch.
Yeah.
Thanks.
I have given a big task for that keep you. So the time we say exercise, these two faces will be coming. Sir, Raju, जो है ना, he was exercising and diet. So exercise kill. Why you are saying? And the reason is it is a myth. I think it is not coming. It is a myth. Never ever take it. There are only a few conditions in which you have to think about it, and it is the only doctor who will tell you. So these are only, I can take 5 conditions which can easily be diagnosed by ECG and echo. So if you find that your family member has suddenly died during any exercise or during activity or untold, means he was doing fine, all of a sudden death, these possibilities, CPVT, long QT, congenital coronary anomaly, hypertrophic cardiomyopathy, just do ECG echo, it will be out. It will not be present. You can rule it. There is no contraindication, means there is no any chances that you are having disease in which you can die. Okay, so these are simple way, and the reason what we have been told that these illnesses, exercise trigger. It is not the cause. It triggers something what we call a sympathetic drive, and it go in a way that the rhythm goes out of order. A killer rhythm comes, and finally the person comes. So this is the one of the reason where we have to be careful, or where we have having a reason for not exercising. Now coming to the, I think everybody is will be aware about it. Sitting in versus smoking. How many people are knowing this fact? If you are sitting more than 8 hours, you are a smoker. Okay. So this concept is also a very evolving concept. So if you are sitting more than 8 hours, not exercising, your risk and the person who is smoking a 1 packet of smoke, whatever cigarette is almost same. Okay. So if you are sitting, it is not a good thing. Sedentary lifestyle is not good. It is well known, everybody know, but हम लोग को सब पता है, लेकिन तब तक हम लोग घुसना नहीं चाहते रहते कि कोई धक्का नहीं मारता. धक्का मारने के लिए कभी डॉक्टर आता है, कोई बीमारी आती है. So all those things we have to think. Sitting is the new smoking, and that's why if you are sitting in your chamber, make opportunity that at least 15-20 minutes or 30 minutes you can spare time in the morning hours and do exercise, and then come and work harder in your chambers wherever possible. Now, this is all about the exercise, all about the food. Now, the core issue is how to identify I'm having heart disease or not. This is a big question. Am I correct? And everybody want to know that self-evaluation. So there are some symptoms. There is called a clear-cut symptom on which you have to keep in the mind that probably you are suffering or you are undergoing some cardiac problem, and you have to go to the doctor to verify it, confirm it, and finally get treated. So symptom of the heart disease, these are the almost 1, 2, 3, 4, 5, 6, 7. 7 symptoms are there. And the first symptom, which everybody is knowing regarding that, chest pain. Breathlessness, सांस फूलना. Only 2 diseases, one is cardiac, other is respiratory. Pedal edema means swelling in the feet. Fatigability means you are able to climb first floor without any difficulty. After some time, you are struggling to climb for the first floor. That is called fatigability. So you are getting fatigued. That is also, but it's a very subtle finding, very difficult to objectify that is, you are having the same palpitation. सो palpitation is called धड़कन, मतलब होता है ना कि आपको ऑल ऑफ ए सडन कोई ऐसा काम दे दिया गया या बोला गया कि आपने चोरी किया है और आपको पुलिस आ रही है, यू हैव नॉट डन एंड यू आर scared, so beating start fast, or you have seen all of a sudden snake, nobody is there to rescue, and you will be just counting, or some bomb blast has happened nearby and you are seeing some blood blast will happen. So your feeling of beating which you are able to listen or you are able to feel, that is called palpitation. So that is called provoked palpitation. Means some cause is there for your palpitation, but it may be possible that without cause also you can get palpitation. So when you are getting a palpitation without cause, you are sitting all of a sudden heartbeat has started feeling, and you are not having any reason to explain it. That is called unprovoked. So that is also a part of heart disease. And there the role of Dil Ki Dhadkan ke doctor means electrophysiologist like me will be coming to in your life. Okay. Next is the loss of consciousness, giddiness, and syncope. So this is also important, means somebody has become unconscious all of a sudden. Immediately they will rush to the neurologist, they will do the CT, MRI, and everything is fine. Dizziness, you are getting giddiness. पिक्चरों में दिखाया था ना कि अगर कोई आदमी गिर गया तो प्रेगनेंसी दिखाता पता नहीं how they have make it those things, but yes, those symptoms are there in the first trimester, but same thing. चक्कर आ गया अगर मतलब मेरे ख्याल में 1970s 80s की मूवी है तो until proved otherwise they are going to show that the lady is even pre-marital, post-marital, whatever she is going to be pregnant. And fainting or syncope, that is called fainting. Okay. And sudden cardiac death. So sudden cardiac death or sudden death, wherever it is happening, the cardiac reason is very, very important. In that cardiac reason, we call as cardiac arrest. Means heart has stopped within minute or within seconds. So that is also part of the cardiac diseases. And whatever I am explaining, it is there in this book also, which I have written for people like you, and it is available in the Amazon also for last 6 months. So if you want some detail about it, go through it if you are interested. And we are having 4 type of disease in the heart. One of valve, जो है ना कि heart के अंदर में 4 valve रहते हैं. And second is the vessel. We say 2 coronary arteries, and sometimes we say 3 vessels. There is no 3 vessels, there is only 2 vessels, but one vessel is divided into 2 parts. That's why we can 3 vessel disease. There is no 4 vessel disease. At only 3 vessel disease, 2 vessels and single vessel. Vessel means coronaries. Third is the electrical system of the heart. Heart is having its own generator and system. It will work. That's why you will say brain is dead and heart is enjoying. He is pumping the blood to all the organs. I will not leave you till your money is over, and you say, okay, हमारे पास money नहीं है, अब ventilator से निकालो हमारे. Then only they are going to say. Then we are going to take out the ventilator and whatever the oxygen which was going to the heart. It is over, and the patient will be stable. And finally, the muscles diseases. So we call it the cardiomyopathies. So these are only 4 variants of the heart diseases. And in the heart diseases, the most important and discussed at all the forum, which take the means like Shahrukh Khan जैसा सब चीज को छुपा देता है, that is atherosclerosis, coronary artery disease, मतलब बाकी सब छोटे छोटे हो जाते हैं इसके सामने में. And the reason is कुछ भी हुआ इसका ट्रीटमेंट हर जगह पे होता है. Every nook and corner people are knowing that कोलेस्ट्रॉल बढ़ा, ब्लॉक आया और उसके बाद मर गया. बस इतनी की स्टोरी बनाई जाती है. एक लड़का एक लड़की, उसके बाद शादी हुआ, बच्चे हुए, तक वाला पार्ट भी नहीं दिखाते. But here it is not. The cardiology is full of enigma. Atherosclerosis is also an enigma. How it happens? This disease starts when I am in peak. I am still in 50s. I am still enjoying it. Why I am not having? And my friend who is there in 35, he has died of the heart attack. So this story is still incomplete. We are making a lot of hypotheses. One of the hypotheses, or we can say one of the risk factor, we are knowing cholesterol and all those things. So I will not go in detail. So wherever the blocks are there, it can block your coronaries, becomes the heart vessels, and the blocks will be 50, 70, 90, whatever. But 70% block above, at least you should know that it is need intervention. You have to stent or bypass wherever possible if you are having symptom. And if it can affect your brain, then it is stroke. We use the word stroke for that. If it is happening in the heart, we call myocardial infarction, means heart attack. If it is happening in the kidney, we call as a renal artery stenosis, means the kidney is having damage, and that is secondary cause of blood pressure. Blood pressure go up, kidney is damaged. Peripheral arterial disease, lower leg vessels are getting clogged, so peripheral arterial disease can be one of the disease in that. Now, and this need for everybody that they should know in and out about. And this is a lesson I teach to everybody who comes to my chamber if I get the time, what we call as angina. So it is a medical emergency if it is happening in the what you call it, sitting posture, you are at home or you are at work and all of a sudden you are having chest pain. So first, you should know whether you are undergoing angina. Angina means chest pain which is due to the heart. So this is having a different character and that has to be identified. If you are well versed, yes, I am having angina, you should immediately reach to the hospital or the person who is having, he should know. So this is exactly what happens. So when your coronary artery is all of a sudden getting blocked, means choking of the circulation is happening. What will happen first? Like आपका पाइप चल रहा है, पानी बंद हुआ तो क्या पानी ऊपर आया? The same thing, the same similarly the sensation when the arteries get clogged, it will give a different type of sensation. Somebody is sitting on your chest. This is a very typical sensation. Heaviness, or somebody is pressing your heart. So up to that, everybody is clear. This is called angina, first part. Second part, the time he start walking, he will say, okay, I am not comfortable, it is getting increased. Then he will be standing for a while, he will feel somewhat better, or it may start reducing also. Then he started walking, again it is. So this is the second character, means heaviness, or what you call chest pain, which is on in, walking, it is increasing. And while taking rest or when you are stopping, it is reducing. It is until proved otherwise, it is cardiac. And if it is happening in the resting stage, it is a medical emergency. Immediately you have to call, you have to reach to the hospital without wasting time. The pain can go, or the sensation go into the arms. So this is the important part. So it is a something which is pressing your heart, pressing your chest. The sensation can be on the front of the chest. They will certainly say, sir, यहाँ पर दर्द हो रहा है. They will not say यहाँ पर दर्द हो रहा है मतलब it is not cardiac. You can't pinpoint. This is called pinpointing sign. If you are able to pinpoint pain यहाँ पर, it is not cardiac. But if you are saying, sir यहाँ पर ऐसा लग रहा है कुछ वजन रखा हुआ है. These words are very very typical. But there is a story behind it. One patient has, when I was doing my DM, he came like this one, and the emergency person said, right, ECG, cardiac emergency, and it was night, 12 o'clock in the night. We have to do it. When I was doing my DM in IPGMR Kolkata, so they asked, sir, भेजा उस समय हम लोगों को 12 ECG निकालने के लिए 15 मिनट लगता था, पानी लगा के इधर गवर्नमेंट में. I think you have not seen how it has been, how difficult. And being a doctor of DM degree, we have to do those things, ECG in the night. So इसी उसमें से 10 लोग गाली दे रहे हैं, सर आपको ECG भी नहीं करना, आप तुमको ECG भी नहीं करना, वो नहीं पता कि he is a doctor, he is doing all those. And he was saying, सर मेरे को यहाँ पर फ्रैक्चर हुआ है, and I am coming like this one. So the story is that the doctor, he didn't want to waste the time. He thought he's having a heart attack and he has sent it, and he's having the fracture. So this story goes in when you have to disperse the medical, you have to disperse 30 people sitting in the emergency. Okay, you go this one, ECG, and that one, and he will manage all those things. Later on, I will say, "तुमको fracture तो यहाँ क्या करने आया?" So he was not removing from here. So we have to take the ECG, and he was not. So there is something like that. Okay. So this sensation is very, very essential. So whenever happening in and around your family, always try to question it. Whether you are having this thing, it is increasing, and on top, if you are getting sweating, you are getting weakness, no time, you should just rush to the hospital. So how after this, nobody will miss the angina of themselves as well as in the family, because it is a medical emergency, we should know. So sometimes chest pain, pressure, squeezing sensation, indigestion. So gastric problem sometimes mimics with it, and a lot of time we miss that is a gastric or cardiac. I don't want to go in detail because it will be a lengthy discussion, but for a timing, just I want to impress one point. If your gastric sensation is in and around this chest region, and it is happening on and off, which is not relieving by taking the gastric medicine, that is a red flag sign. It may be cardiac also, it may be gastric, but if it is not relieving or partially relieving on the taking the antacid, it may be gastric. ECG is must, and you should not miss any time. At least do the ECG. And if it turn out to be a heart attack, which ECG most of the time detect, you can treat properly. Second thing is elderly patients. You may be seeing in your family also the persons who has crossed around 65 or 70, they will be having one symptom. खाना खाने के बाद सब कुछ ठीक है, 2 घंटे तक they will struggle. कुछ difficulty हो रहा है, I want to sit only. They will not move. Like कहते हैं ना, आज का खाना के बाद चुपचाप बैठ जाए तो उसी तरीके बैठ जाएंगे. For 2 hours, 2 hours later they will say, I am now comfortable, I can walk now. The reason is they are having difficulty, we call it the angina equivalent. The gastric type of sensation is persisting, but this is not a same sensation like angina, what we call. So it is similarly. They will get somewhat breathlessness, okay, no, I don't want to move. So within 2 hours, if you are getting heaviness, gastric sensation, which is not relieving, repeatedly happening, those patients are having cardiac, and it is the need that they should be put on the medicine or further evaluation. Okay. Some of the heart circulation is on the back side of the heart, so their sensation will go on the back side also. So back pain coming to the front, or it is coming in the arm also. But the sensation is very important. Walking increasing, sitting going, until proved otherwise it is heart. Okay. What you should do, I think everybody should know what we have to do when this sensation you have seen in your any family member or in yourself. Reduce the mental tension. पॉसिबल नहीं, बोलना इजी है बट डिफिकल्ट है. आपको पता चल गया कि हार्ट का प्रॉब्लम है, सो reduce the physical activity. This is your hand. You know that you are having now this sensation, the timeline has started, we have to reach to the hospital, but you are trying to go from here to there, you are going up. Give a call to the person who can reliably transport to your hospital. It may be family, it may be friend. Either it is a night or day, it doesn't matter. It is an emergency, you have to reach it. And reach the hospital early, rush to the nearest center. So what happened, a lot of doctors, a lot of patients are there, they are residing very far from their own doctor, own cardiologist, maybe having heart attack long back, later on they are, वो पहले सिकंदराबाद थे, अब हैदराबाद में गच्चीबौली और सिकंदराबाद, they start chasing their doctor. He may be picked, okay, तुम आ जाओ यहाँ पर. That is not correct. Gachibowli or Secunderabad, both are having the cath lab, both are having the good number of cardiologists, good cardiologists are available. They can relieve the pain then and there by doing the right treatment. If you are transporting the patient, you may miss the bus, you may come in the way. So that should not be done. So wherever you are staying, you should chalk out the area in 2 kilometers with your transportation to whom you are going to contact if you are having any family member, and chalk this hospital I will go whenever the emergency is there, and you have already known that what are the doctors available, what are their reviews. Reviews means I don't want that you should go by the Google review. You should know from your colleague how they have been treated, how the hospital good is. And since I am from Kerala, I will certainly say if at all is there, we are always available. So that you have to check. I don't want to promote my hospital. It is not my duty to do it. There is a period in there they should do. And never chase your doctor, never chase your center. You read to the nearest center. Now, इतनी सारी बातें कर रहे हैं, लेकिन उसके बाद की स्टोरी है that is a very painstaking for me also, and it has given a lot of I also lost the confidence when I saw this boy. He's 28 years old. He's a doctor, fitness freak, marathoner, and teetotaler means he was not taking any tea, coffee, smoking, kuch nahi tha. He was for almost 2 years in Siachen. As a doctor, he has worked. And 6 months back, he came to Hyderabad. He was posted in his center. He was went for running, and he came some chest discomfort. Being a doctor, like you, now you are also intelligent angina. In time, he is having chest pain, angina chest. He went into the hospital, take the morphine, take the aspirin tablet, atorvastatin, and walked to my chamber. Waited for half an hour. I was doing my intervention. I came back. He told, sir, I am having some chest discomfort. Looked like to be angina. I need evaluation. ECG was done. ECG was having minimal changes. Echo has been done. Echo was also showing not very clear-cut any problem. Then I told, why you are saying angina, you are having sweating and all those things. Why not to go for angio? No, sir, I don't want to take chance. Let me complete the angio. And this is the angio of the patient. Can you run this one? Somebody? In the lower part, just if you are pressing, it will come. So this is you can see this artery is totally blocked. This is a major artery of right side totally blocked. Then we are taking the thrombosection balloon and taking out all the clot. and later on the circulation starts flowing. And this says that even you are doing the one of the best activity, you are not having any habits, you are not having anything, still you can develop heart attack. So it should not surprise you. You should be prepared. This person walked, drive, run, and came to me with heart attack. Why? The reason is only one. He was investing time for his health. He was investing time, what I was saying, for the collateral circulation. And that's why you see now the artery started flowing, the lower part, the black part, what you are seeing, the circulation started happening, and the patient chest pain, whatever means my minimal pain was there, that also relieved. And he was kept for 2 days and we put on medicine and he went home. And both husband, wife, doctor. So I think you can see now the whole artery is recanalized, or you can say the opened up. So this is the important thing that we should know, that artery can block, emergency can happen. We have to prepare by, one is the time investment and second is preparation. When I am having, where I have to go, to whom I have to reach. And if you are doing, this is the homework that you can do. Rest of the things, blessings. If you have been blessed that you are going to die at home, take it. Nothing wrong in that. And if it is still at a hospital, you have to invest and do it. That is also, it is none of your business and we should not think about it. So there are two things, circulatory block and electrical failure. So this is called the killer. All the killer, whatever they are saying, block. ब्लॉक से पेन आता है, ब्लॉक के बाद जो दूसरी स्टोरी होती है ना, पार्ट 2 स्टोरी जो कि दिखाया नहीं जाता, दैट इज इलेक्ट्रिकल प्रॉब्लम. सो द पर्सन हु डाई एट होम, दैट इज अ गॉड ब्लेसिंग. उनको बोला गया कि आपका हम आर्टरी को ब्लॉक करेंगे, उसके बाद आपको पेनलेस तरीके से इस दुनिया से बाहर निकालेंगे, आपकी रिदम को इतना फास्ट कर देंगे कि आपको पता भी नहीं चलेगा, एंड यू आर आउट. Nobody can save you. Even you are in the hospital, you can't be saved. That is called VT and VF, ventricular tachycardia, ventricular fibrillation. So these are the killer rhythm. Aya, you will be getting only 10 to 30 seconds. 10 to 30 सेकंड में आपको आइडेंटिफाई करना है. आइडेंटिफाई कैसे होगा? ईसीजी से होगा. ईसीजी लगाने में कम से कम 15-20 मिनट लगता है. योर स्टोरी इज ओवर. सम ऑफ द पर्सन्स रिकवर, मींस उनका रिदम आया 10 सेकंड, थोड़े से झटके आए, झटके मतलब व्हाट यू कॉल फिट्स टाइप का हुआ, थोड़ा देर के बाद बोले मैं किस दुनिया में हूँ, आई एम नॉर्मल, नाउ पेन इज हैपनिंग, नाउ गो टू द हॉस्पिटल, एंड देन द डॉक्टर, इंटरवेंशनल कार्डियोलॉजी विल कम एज अ hero and he will open the artery and they will say, yes, I have saved you. But it was not the same. The God has given the opportunity that you should visit, invest in the hospital. They are running so much business. Okay. So heart attack, it is a circulatory problem. And whatever you are saying, cardiac arrest, it is an electrical problem. So most people who die suddenly, the reason is cardiac arrest due to the electrical problem. It may start with the heart attack, and after the second, what you call second rebuttal, means not to say rebuttal, the second complication, what is the electrical problem, which usually happen in 25% of the heart attack. So these are the fortunate painless death patient who will not reach to the hospital. They will not be shown that उनकी artery में block था, heart attack हुआ, मर गए. Heart attack हुआ था, उसके बाद दूसरा साहब भी आगे साथ में, तो कि नहीं आपको हम पेनलेस तरीके से ले जाएंगे, वेंटिलेटर इंटरवेंशन करने की जरूरत नहीं, हॉस्पिटल को इतना मनी देने की जरूरत नहीं, यू शुड गो पीसफुली फ्रॉम दिस वर्ल्ड. सो दैट इज कॉल्ड कार्डियक अरेस्ट एंड ऑल दोस थिंग्स. So cardiac arrest is an electrical problem, and this is dealt mostly by the electrophysiologist. That's why I have to say that everything has been taken by the interventional cardiologist. Stent पता कर लो ब्लॉक है, ओपन कर दो, जिंदगी लंबी हो जाती है. ऑल थिंग्स आर rubbish. Don't rely on those things. That will relieve your pain. That will chances of heart attack may be less when it is a significant, but it's not going to change the story of your course of illness. So I think you all should learn what we have to learn when you are seeing cardiac arrest. I think everybody has seen this movie. ये आदमी कैसे जिंदा हुआ था, किसी ने आँख में कान में आके फूका, उसने उसके बाद वो पूरा पावर आ गया, and he started dancing and killed everybody. So you can also become the same person. This, how you are going to be? By learning the CPR. So do the CPR and you can give the second life. So CPR is the one of the thing which everybody should learn. I think a lot of sessions may have happened earlier also. So this you should not miss, because this is the only thing which being non a doctor, you can behave as a doctor, you can be a god for that person for a time being. You get opportunity to become a doctor and save the patient, or you will be told like that, but yes, it is the opportunity. Now coming to the second complaint regarding the heart failure. Heart fail कर गया इसलिए मर गया. Heart fail करने का one of the story is that it will take some time. There are some symptoms. Heart attack followed by heart failure. All of a sudden the lung will start pulling the blood and you will get the breathlessness. So this is a usual complaint. Sometimes it will be very short interval, means valve start leaking, chamber getting hole inside, and then the blood start pulling. So these symptoms will be coming. And this, if the person is having chronic means slowly going process, then the swelling in the feet, low energy, fatiguability, all those complaints will be coming. I will not go in detail. Book is there, you can certainly go through it. And one important complaint that you should remember, you should try to see in your family member, if somebody is using too much, what you call pillows, he may be having cardio. Means he was comfortable one pillow, then he say, no, no, some difficulty, I am taking two, three. This is the mark of a complaint because the orthopedic means he is not comfortable in the normal sleeping because lungs is pulling the blood and he is getting breathlessness. So he is increasing his, and if it is a cardiac patient, it is a, one of the symptoms of the heart failure. If somebody is in the midnight, maybe 10 o'clock, he has gone in the bed and within 2 hours he started struggling. I am getting very much breathless, open that windows and then after 15-20 days comfortable. This is also an impending sign of heart failure. Means his heart pumping is weak and lung is again pulling with the blood in the night time. And it will happen in the night because of paroxysmal nocturnal dyspnea means रात में उनको दौरे पड़ेंगे सांस फूलने का उसके बाद नॉर्मल हो जाएगा. I am not talking about the psychiatric ladies. I am talking about the particular means कुछ लोग होते रात में बोलेंगे हमको सांस फूलता दिन में एकदम ठीक रहेंगे. वैसा नहीं, उनको रात दिन में भी सांस फूलेगा और रात में all of a sudden this type of episode can happen. Not take it feminine man. I am saying for the anybody who is having symptoms more in the night. Okay. Risk factor important. This is important for everybody because hypertension is a billions disease. We are almost now 8 billions or 7 billion population in the world. I think recently we have reached to the 8 billion. So in 8 billion, you can think about it is around 1 to 1.2 billion people are with the hypertension. This is the what do you call epidemic of this disease, and in this a lot of misconception is there. So just I will take 1 or 2 minutes on this. Blood pressure is not a fixed thing; it will fluctuate. If it gets fixed at a high level, which has been defined as 140/90 for the adult population, without any reason means you are having a sound sleep, you are not having body ailment, you are not having any sort of acute stress or illness, and it is sustaining at 140/90 for few weeks or months, then you will be labeled as a hypertension. If it is 120/80 is called ideal, it can be there. Ladies will be having 100/70, 90/70 also. It's not low, it is called normal blood pressure for them. 130, 140 is also normal. But when it is crossing 140/90, persisting at that level, we call it a resetting of blood pressure on the higher, and it is called hypertension. And if it is happening, then you have to treat it. One time you have gone to the doctor's chamber, he says, oh, 150/90, okay, take this medicine. This is not a correct way. We have to see your sleep pattern, we have to see your, we have to see your family conditions and your stress. And then if you are not getting anything, we will say that, okay, go and get 1 week blood pressure. And then after that, we will take a call whether we will need or not. Okay. So BP will be having a domino effect, means एक के बाद एक पत्ते गिरते जाएंगे. So as you know, the blood pressure in the vessels are increasing, so it will damage that vessel. Think about it, a vehicle is there, it is supposed to go up the stairs, and you have to put a first gear. But you are driving all the road with first gear, what will happen? The same thing is the blood pressure. So you have to increase the blood pressure in a particular situation, but without reason, if your blood pressure is higher, it is in the first gear, then the things is faulty, we have to correct it. उसको fourth gear में फिर लाना है कि normal road आ गई, अब आराम से चला सकते हैं. The same thing, put a medicine, bring the blood pressure on the normal so that the organ should not get damaged. Cholesterol. So only two values I will say, HDL and LDL. Only and only concentrate on these two. When LDL has repeatedly crossed 190 LDL, I am not talking about total cholesterol. It is a mark that you are having a very severe lipid problem and you have to put on the medicine. and your HDL is anytime less than 40, you have to exercise more. There is no medicines. So LDL, watch your LDL. It depends upon there are a lot of risk factors are there. We have to identify and then we have to treat it. But 190 is the value on which you need medicines without fail. It may be troublesome in the future. A good bet, I think Google करेंगे, book में पढ़ेंगे, सब मिलेगा. Now coming to the my interesting area, धड़कनों की बात करते हैं. So what we call as a rhythm problem. So rhythm problem will be giving some symptoms, and these symptoms are the what you call pain, palpitation, means like subtle symptom, dizziness, sudden cardiac death, paroxysmal. कुछ लोगों को बीच-बीच में पसीने आना स्टार्ट हो जाएंगे, then they will find weakness, sweating, weakness, like that things will be going. So this is also a mark of rhythm problem. And fainting attack. Fainting में most of the time they will rush to the neurologist and say that sir ये बेहोश हो गया था. बेहोश होना, all of a sudden you collapse or you faint and then you recover within seconds or minutes. This is called spontaneous recovery from your posture. That is called fainting. So if fainting is happening, it is a cardiac, more electrophysiological, electrical problem or blood pressure problem. These are the two reasons for developing fainting. So it comes in the domain of cardiology and electrophysiology. So why I have to impress this point, because nobody discuss this about this. They will say, okay, सारा टेस्ट कर दिया, सब नॉर्मल, पर बेहोश क्यों होते हैं, we don't know. So always visit a electrophysiologist. They will certainly do a different type of test to pinpoint where the fault is. So syncope is now. Sorry. Syncope is electrophysiological problem. Now coming to the suffering of heart starts with mind. किसी ना किसी को कुछ ना कोई बीमारी तो होगी. Everybody has to, when you are aging, certainly some diseases will be coming, and then it becomes very important that how to engulf and how to navigate your problems. Doctor will be there for only 15-20 minutes, maybe in his chamber you will be visiting. But how you are going to face that disease which is going to live with you like your wife or husband throughout next whatever life left to you. So this is the marrying of the disease. You have to marry it. एक बार जब संबंध बन गया तो आपको एक्सेप्ट करना है. डायबिटीज हो गया, कोई बात नहीं. We will live in harmony. So that's why this book has been called Heart Harmony. Means if you are having heart problem, you have to accept at some time. First you have to confirm and then harmonize yourself with the relationship with the disease. You have not to deny कि नहीं मेरे को कुछ नहीं है, मैं एकदम fit part हूँ, कुछ नहीं है, सब डॉक्टर बिजनेस करना चाहता है. This is not correct. So somewhere you have to reset your mind. So I think this movie everybody has seen. Yeah? So 12 Fail is a very good movie, and I think everybody has seen, and I think it should be revisited whenever you are feeling depressed. So in this movie there is a important song also. We call it a restart. So लाइफ में बीमारी आएंगी, कोई बात, एक आए, दो आए, तीन आए, एक अटैक आएगा, दो अटैक आएगा, जब तक जिंदा लड़ना है. Simple सा है. There is no way out of this thing. Either it's a diabetes, it is hypertension, anything. Don't wait for Shraddha to come if it is a boy, and doctor for the girls. They are not going to come in your life to help you. These are all what is called virtual world, dreaming world. कि शायद कोई श्रद्धा है कि मेरी लाइफ अच्छी हो जाएगी, ऐसा कुछ नहीं होने वाला है. You have to change your mind. So resetting the mind is the most important thing, because the biggest enemy and best friend inside is your skull. उसको आपने जीत लिया तो सब कुछ जीत लिया. कोई डॉक्टर की, आई विल नॉट से डॉक्टर की जरूरत नहीं है. डॉक्टर की जरूरत है, उसका एक गाइडेंस की जरूरत होती है, उसके कुछ मेडिसिन के प्रिस्क्रिप्शन की जरूरत होती है. लेकिन लड़ाई आपकी, उसकी नहीं है. उसकी लड़ाई अपने चैम्बर में रहना, आपको एक एडवाइस देके छोड़ देना कि भैया ये काम करो. If you are a good patient, you will follow it, you will question it, and if you are too much questioning, you will say, okay, इसको 3 महीने का लिखो, 6 महीने का लिखो, ज़्यादा इस जितना पे करता है उससे ज़्यादा क्वेश्चन पूछता है, और डिफिकल्ट क्वेश्चन पूछता है. So resetting of the mind start with death. Okay, पहला चीज मानना है कि हम लोग यहाँ पर मरने के लिए ही आए हैं. This is called मृत्यु लोक. We have to accept with grace, and nobody is going to Bhishma Pitama, and who is he? Recently, Ashwatthama. Nobody is going to become. We don't want it. यहाँ पर 200 साल रहेंगे, 300 साल रहेंगे, अच्छा है क्या? It's not. जल्दी जल्दी बॉडी चेंज करो, ये बॉडी थोड़ा बूढ़ा हो रहा है, नेक्स्ट बॉडी लिया, एंड दैट इज आवर साइंस और वी कैन से द रिलीजन, एटलीस्ट इन हिंदुइज्म। इसके बाद अब कौन से देश में जाएंगे, कौन से अफ्रीका में जा रहे हैं कि यूक्रेन में जा रहे हैं, वी डोंट नो, बट वी शुड ट्राई टू बी इन इंडिया, एटलीस्ट सेफेस्ट कंट्री। So in the Gita 2:27, it is a very important verse, and I think everybody should read every day कि मरने के लिए आए हैं, मरने के बाद फिर जन्म लेना, फिर जाना है कहीं पर, let us take it with grace, जो जिंदगी मिली उसी को एंजॉय किया जाए। And there are three brains, these three brains we have to handle. The first brain we are having in the skull, which is having the highest number of nerves, we call as a cephalic brain, 86%, 86 billion nerves, now it is growing number. Second comes the gut, it is having the second highest number of nerves, and third is the heart. And that's why when you start thinking too much positive, negative, it has got an impact on your heart. So never underestimate the power of your thoughts. If you are positive thinking, it is helping your heart to work proper. एक वर्कर है जो पर डे काम कर रहा है, उसको बोले तुम अच्छे से काम नहीं कर रहे हो, तुम ठीक से नहीं कर रहे हो, मतलब you just think about the heart which is working 24 hours 7, and it works when you are in the 22nd day of your mother's womb, उस टाइम से काम करता है till death. No break, no holidays, enjoy the job. He is passionate to make you living in this world. उस पर भी लोग सस्पेंस, मेरे को लगता है मेरा हार्ट ठीक नहीं, जब करते हैं ना, आई फील वेरी मच कि ही इज नॉट हैविंग एनी सिंपैथी, नो ग्रेटिट्यूड फॉर द हार्ट व्हिच इज वर्किंग हार्ड टू मेक हिम वॉक टू माय चैम्बर, बट ही इज सस्पेक्टिंग, मतलब कुछ गड़बड़ है। एक बार गड़बड़ हम लोगों ने क्लियर कर दिया कुछ नहीं है, फिर घूम के आएगा सर मेरे को कुछ लगता है, मैंने ये पढ़ा, मैंने वो पढ़ा, पढ़ना जरूर है, अच्छी बात है, बट एट द एंड ऑफ द डे यू हैव टू सस्पेक्ट नहीं करना है। सो and thought has got important effect on your, not only the mind, and this is important, one study has been done कि जब आप पानी को रखते हो ना कहीं पर, उसके चारों तरफ we are putting a drop of water, or you can keep a glass of water, and you say that you are idiot, you are nonsense, you don't do this one, and when you say particular you are very good, you are doing very nice job, means you are having two type of thoughts, and you are speaking in front of water. And after that, when the water has been crystallized, it has been seen how the crystallization of the water changes with your words. And nobody else has done this study. It is by one of the scientists from Japan, who is in US. So he has done the study, and he found that hidden messages in water. This is a very important book. He saw that if you are having a compression, the crystals of water will be having a different shape. When you are saying thankful, it is different, wisdom different, and similarly, if it is exposed to the heavy metal music, it is changing. I will kill you. See how the change of the water droplets is happening. You are full. When you are saying a negative word and water before with this prayer, it is going to change. So think about, our body is around 70% water. Your brain is 90% water, and you are exposing with positive and negative. Choice is yours. You want that things should work for you or against you. This experiment has given, if you are giving gratitude, everything will start working for you. So life में problems आएंगे, we all have to face the problem. We are in this age that on and off here, and if life is everything good, you will not enjoy it. Nothing is enjoyable in that. So that is the important thing that we have to learn, that problems will be coming, and emotion has got its own other impacts. So people are saying why the person's at 22, 25 heart attack is happening. So this is one, if the person is very much stressed, having emotions and vascular inflammation will start. Means one burner is on inside your arteries, which is inflamed. Means कुछ पक रहा है, पकने में क्या होता है, LDL, HDL, वही पकने को कहते हैं oxidized LDLs. So जो bad cholesterol which is oxidized, it will stick to the arteries, and the story starts. It can all of a sudden block, or it may slowly progress over the time and clog the vessel. So how to break this? So this is a new dimension, vascular inflammation, what we call the atherosclerosis or the heart block. This is the new dimension. So there are two types of inflammation markers, that is the unsterile inflammation and sterile inflammation. So if patient is having heart attack, stroke, means already there is something inflammatory is ongoing, and that is caused. An unstable is bacterial and viral infection. Sometimes you have change in the gut bacteria that is also leading to the inflammation, that is called unsterile. But if you are exposing yourself with the psychological stress, air pollutions, noise pollution, poor sleep quality, sedentary lifestyle, this is also the cause for the vascular inflammation and blocks. इसके बारे में नो बडी डिस्कस, नो मीडिया कम फॉरवर्ड दैट कि हम लोगों को नाइट में सोना है, सोने के आवर्स फिक्स करने हैं. What Raki was saying, we are forcing our staff that they should take the leave. They want, no, no, sir, we want encashment of our leaves. So I think encashment is not needed. It is the need of the time that you should enjoy also after working hard. So around 25% population are dying due to the air pollution. बट सारा डिस्कशन एक ही जगह रहता है, कोलेस्ट्रॉल कार्डियोलॉजिस्ट ब्लॉक सिटी एंजियो ऑल दोस थिंग्स. आई विल से नाउ स्टॉप टेकिंग द एक्शन वेयर एवर पॉसिबल. सेडेंटरी लाइफस्टाइल चेंज इट, पुअर स्लीप क्वालिटी चेंज इट, नॉइज पोल्यूशन कान में कुछ लगा सकते हैं बिना सुने हुए और पर्टिकुलर डेसिबल पर. एयर पोल्यूशन मास्क, आई थिंक कोरोना में बहुत अच्छा टिप देखे गए. साइकोलॉजिकल स्ट्रेस, इट इज ऑन यू. If you are dealing with a toxic relationship, change, toxic boss, change. अब तो सब कुछ चेंज कर सकते हैं. You can work from home, you can work from remote anywhere. So why don't you change it? I'm not saying that I'm promoting any of your stuff. You all are in a good hand, you can say. The second part, life may, what I say, the problems will come to anybody. Even that doctor who was running and doing everything, he also got the first shoot. It is the first heart attack. So this is the life that everybody has to bear. You can't deny it. You have come in the world to bear the first arrow. And this arrow is responsible for only 20% of the pain. The 80% of the pain is from the second arrow. And this second arrow comes from? Huh? Not. It is pushed by you. How it is? I can die. Why me only? Why not my friend? He was enjoying the smoking. I was not. But why I? Again, I have a heart attack. Now doctor has put one stent. He's saying 20% block in other. Probably next stent in within 1-2 years. Let us see. Why my stent is not doing work? He has been stunted. He's enjoying. I am having on and off pain. All those story. My life sorted. Who's going to look after my kid, my wife, all those things. This is called negative mindset. So these problems comes by you, and that's why I'm saying your best friend and worst enemy is there in your mind. To just cut down this one, you enjoy. You know that you have to die. Your time, date, seconds, nakshatra, everything has been decided. Birth certificate you take, death certificate your family will take. Who has been given? So इसके लिए कोई चिंता नहीं करना है. You should not worry for that. You should worry कि किसको पासवर्ड देना है, कब देना है, and all those things, and how to declare all those secrecies. Mind business, Silicon Valley. So this whole business is coming from the Silicon Valley. So these are the things, and this is the thing how you are being pushed for the stress. So like button, love button, and dislike. You have to be engaged, and our Silicon Valley is working hard how to do. Somebody has cracked in 2009 कि just आप इसमें एक what you call thumb up ला दिए, everybody will, and that was the way the Orkut has been taken and Facebook has taken over. किसी का brain ने काम किया कि कैसे लोगों को engage करना है, they have engaged well. So again it is again from the Gita 262-263 कि आदमी को गुस्सा क्यों आता है. बहुत लोग पूछते हैं, हम लोग भी पूछते हैं, मेरे को गुस्सा क्यों आता है. हर गुस्से के पीछे एक रीजन जरूर होता है. एंड व्हाट इज दैट रीजन? एनीबॉडी? हाँ? ईगो. यस, आई थिंक फर्स्ट इज करेक्ट. डिजायर. आप इस दुनिया में आए, कुछ ना कुछ डिजायर तो रहेंगी, कुछ फुलफिल्ड, कुछ अनफुलफिल्ड. अब फुलफिल्ड के बाद फिर फुलफिल्ड. दिस विल बी गोइंग ऑन, एंड दैट्स व्हाई योर माइंड हैज बीन ब्रॉट इन दैट वे. If you are an animal, your mind is for only 4-5 things. If you are a human, you are having a lot of things. And Silicon Valley is giving a lot of things. हमारे 1500 फॉलोअर होने चाहिए, मेरा ऐसा घर होना चाहिए, वैसे everything you will be totally in the mind. Desire. The time desire comes, if you get, then law of what we call dimness utility, what we call as economic law, marginal utility, कि whatever you get after that it will not be good. Means आज आपको iPhone 15 मिला, 15 days you are very good, very nice, 16 days में कुछ मजा नहीं, 16 वाला ज़्यादा better. Like that it will be coming, like that the mind works, and this mind has to be sent. So when you get, you will be getting, you are going to search for the second. If you don't get, you will get anger. मेरे को क्यों नहीं मिला? मैं छोड़ूंगा नहीं. I will try to get it. I will try hit it, and there the anger starts. If you suppress it too much, you will burst out somewhere. So anger को दबाना नहीं है, chase करना है, better करना है to get it. If you really want the right thing, if you are wanting something for the society, you will never get anger. If you are something you are wanting for the body, certainly you will get when you are not getting it. So पूरा story जो है यहीं पर चलता है. What you call amygdala. So amygdala is nothing. It is the animal brain. आपका एक होता है ह्यूमन ब्रेन, एक होता है एनिमल ब्रेन. सो मतलब किसी चीज को हाईजैक कर, इस रूम में बैठ के आपको हाईजैक कर दे, आप बाहर नहीं जा सकते, जो मैं बोलूंगा वही करना होगा. द थिंग्स हैपनिंग, द सेम थिंग इज हैपनिंग बिकॉज द एमिगडाला हाईजैक. सो द फियर, anger, all those things, if it has come anytime, if you are going in the boardroom, if you, I don't know how many people have gone, they will, if you want to know the truth, they will just instigate, you have done this one. Immediately will boil up. No, I have not done. He has done. Immediately the thing will slip down, and they will take out the right thing from you. The reason is anger. Anger will give us all those things what we want. So low emotion, your brain is working very well. The time your amygdala is been what you call hijacked, means the things is not flowing to the higher center, and you are animal. So your behavior will be more like animal, and this is done by our माइंड बिजनेस मीन्स सिलिकॉन वैली. वो आपको इसी चीज के लिए उत्तेजित कर रहा है. लाइक बटन, फॉलो बटन एंड इंस्टाग्राम, ऑल दिस. एक टाइम इंस्टाग्राम में घुस के देखिए, आई हैव ट्राइड एंड आई हैव कम आउट. आई डोंट वांट टू गो देयर, बट आई हैव सीन हाउ इट वर्क्स. So check your thoughts. When your mind is weak, strong your heart. If your heart is becoming weak, strong your mind. And there's a very good saying by Swami Vivekananda, and I have pasted in my room also, who has visited anytime. Anything that makes you weak physically, intellectually, or spiritually, reject as a poison. It can't be correct. If something is empowering, it can be correct. If it is reducing your intellectual level, or you can say physical energy, it can't be. It is a poison. So never accept it. If somebody is saying आप एकदम अच्छे नहीं है, या something which is reducing your energy level, it can't be the right thing, or it has not been presented in the right way. About these two persons, anybody? सब सो गया लगता है. अरे बताओ, गूगल कर रहे क्या लोग? हाँ, सचिन है. अरे वाह, मैं भी नहीं जानता था. चलो. So Sachin and Vasim, about these two persons, two things we should learn. About him, Sachin, everybody knows he's a calm, cool, and he know how to use the tongue. कहाँ use करना, कितना use करना, कब करना. Cricket में आप how you can open the what you call warm for you against the media and your contenders, you don't know. So he's a very calm, cool, and he only focus on his batting, how to do better. That is his way, and that is the way anybody who is professional, he should do it. Second person needs more appreciation for one reason. He's from Pakistan. He is type 1 diabetes. Type 1 diabetes मतलब इनका इंसुलिन का लेवल जो है ना, इनको हमेशा कैलिब्रेट करना है. आप सोचिए कि आपने खाना ज़्यादा खाया तो शुगर देखना 150 है, तो इसके लिए 4 यूनिट ज़्यादा बढ़ाना 4. And this you have to do throughout your life. How blessed we are. Can you imagine? You are not blessed with this type of illness. So we never count our blessings. हमको एक खांसी होता है तो उसमें मेरे को ही खांसी क्यों हुआ, उसको क्यों नहीं हुआ. All those nonsense we start thinking it. मेरी immunity क्यों down हो गई, मेरे को all negative. But this person, he has outperformed with type 1 diabetes. He was a world #1 bowler in his time. And the only thing what is important is the discipline. He knows that he's accepted. That's why I'm saying harmonizing. We have to accept that I am diabetes. I have to live with this disease. I am married with this one. Through my lifetime, he or she or whatever diabetes you take it is his life partner. Now I have to harmonize it. इंसुलिन लेना है, घटाना है, बढ़ाना है, खाना है, कितना खाना है, किस टाइम, everything he has said, and he enjoyed till now and is doing good still. So that is importance of accepting and finally taking action. Big B, if you know or not, he is still at the age of 80, I think, right? 77 it is written. He is now 80, 81, I think. He still invests 1 hour in gym. If you call him at 2 o'clock in the night, means morning, early in the morning, he will be 155. He's so time specific about his work culture and work ethics. And he say one thing, whatever I do, my 1 hour is meant for this. Nobody can take it. I will schedule everything accordingly, but 1 hour of my exercise and gym can't be taken. And he's suffering for almost 15 diseases, in which one disease we call as myasthenia gravis, in which if you are not taking the pill, your respiration will not happen, you can die. With that disease, he is outperforming at 82 years. And that's why I'm saying it, never ever underestimate the power of your brain and discipline. If you underestimate it, certainly you are, I say, no, best friend and worst enemy. So motivation get you going, but discipline keep you growing. So this thing you have to keep in the mind, and wherever possible, do it. And the final thing, we are struggling with all the inflammation, what I was saying. So how to reduce the inflammation? This is the next question. So something we have talked about the exercise, gazette-free environment wherever possible. कुछ नहीं है तो भूटान चले जाओ, वहाँ पर नेट नहीं काम करता है. Heal in the nature, go in the healing place, sleep well wherever possible, try to get a right partner with you, and touch from the loved one. So this will certainly make, if you are having a good relationship, कोई भी बीमारी आएगी, you will both, you can sail your boat very easily. But if your partner is not good, and you are not taking care of, or the second partner, you can say the first partner is your body, you are not taking care. You want, I want to, because brain has been given, it want no change. दैट इज द फर्स्ट पार्ट ऑफ द ब्रेन. उसको थोड़ा भी है ना कि कुछ चीजें उसको पसंद नहीं है, आप जिसमें रह रहे हैं उसी में रहिए. आप थोड़ा सा बोलेंगे 8 की जगह में 7 घंटा सोना चाहते हैं, दैट इज नॉट अबाउट. इट इज लाइक एलिफेंट, इट इज सिटिंग ऑन यू, यू कांट. You are Mahant. Mahant means the person who is sitting. You have to slowly train. Okay, I will there 5 minutes, 10 minutes, and slowly you can create to 1 hour. So like that, you have to expand it slowly, bring it in your practice, and finally you will accept it. So फिर हम लोग गीता का पाठ कर रहे हैं, बट इट इज नीडेड. व्हाट वी शुड डू, व्हाट वी शुड नॉट डू. सो रिगार्डिंग व्हाट फाइनल मैसेज, if I have to summarize, so युक्ताहार विहार से युक्त चेष्ट कर्मेषु युक्त बोध योग. If you really want to avoid the problems in the life, you have to moderate everything. So your habit of eating, sleeping, recreation and work, it has to be balanced. You can't means middle with one and say that I will be. You have to middle, and that's why Raki was correct. हम लोग फोर्स करते हैं, जाओ छुट्टी लेने बोलते हैं, हम लोग इनकैश करेंगे. इनकैश करके क्या करते हैं, हम लोग को जाकर देते हैं ना, हॉस्पिटल में आओगे इनकैश करोगे. It is not needed. It is a time that you should go and enjoy with the loved one. They really miss you. Thank you so much for your time. And so whatever I was saying, I am not saying that I'm talking to you. I really practice. So this is my records, 4,275 kilometers in the last 4 years. Every day I usually run around 5 to 8 kilometers. This is my record of 42 kilometers, means marathon I have completed in 4 hours 57 minutes. And I have written 2 books. One book I have shown you, and one book is for the cardiologists who want to practice in the electrophysiology. So doing all those things, I have completed around 48 years on this planet, and I am fortunate that whatever the God has given me, I will enjoy it. So if you really are interested, so this is the, whatever I have discussed, most of the things is there in this book. It is basically meant for the general public, because they used to Google all those things. What is there in the heart, how, what is the block? They will Google half of the knowledge, and they will again, doctors are very intelligent, they will make you anything. But this book will guide you to ask the right question, as well as what treatment you should augment the options. And this is available on the Amazon. So if you really want, you can buy it. I'm not promoting it, but if you are having some interest left even after this presentation, I will certainly love that you should read it. You should give your reviews. It will help us to make it better in the coming times. Thank you so much.
Thank you so much, Doctor. Thank you to everybody. I think you didn't just cover a topic on heart, but you also told us a lot of life skills, right, that are good for us. So thank you so much, Dr. Ashutosh. I really liked a lot of the concepts that you talked about, the second arrow effect. If you remember that, right? So, and many more. But thank you so much. It was a pleasure having you. We just wanted to run one more video because we wanted to showcase some of our employees who supported during the blood donation drive. And we just made a quick video about them. And you all can just look at it. It's just about a few seconds, right? So we just would like to play that. And if any of you are here, we'd like you to come forward. And if you have any questions, we are just going to take them after this 30-second video. Okay? So think about the questions. If you have any for Doctor, please think about them.